Well, hello and welcome to Sunday Morning Coffee with Dr. Childress here. Now, today as you can tell, a different location. I'm out on my patio today because Mr. Pippin's asleep in my lap and I didn't want to wake him up. So your backdrop here is rather boring, black and white. But mine's not because I get my patio and so I have a lovely view. So unfortunately for you, you don't. But I'm kind of feeling a little lazy this Saturday or this Sunday, and Mr. Pippin's asleep here. And so I said, I can do this from my patio. We'll see how the sound works and everything on this. Now, today, just talking to the parents, just sort of informally about where we stand, our current status on things, to kind of help you orient to where we are and what directions you can go. And where we are right now is you need to be documenting the symptoms. Now, you don't necessarily, the mental health people need to be documenting the symptoms for you because once we get the symptoms documented, we can diagnose what the pathology is and get it fixed. Because diagnosis is a pattern match of symptoms to diagnostic criteria. So if we're just matching up the symptoms to the diagnostic criteria, well, the first step is to document what the symptoms are. Okay? And then we can match the pattern to that. In addition, this is a very chaotic and pathology, and it hides, and everybody's fights about it and things. We need to get clarity on what everybody's seeing. Are you seeing the delusion? Are you not seeing a delusion? Are you seeing narcissistic traits? Are you not seeing that? What are all the mental health people seeing? So what's the individual that's therapist? What are the symptoms they're seeing? What are the family therapists? What are custody evaluators? And get consistency on their reporting. That's the feature across all these people. Consistency on the reporting of symptoms. Now, typically, in the real world of healthcare, we would get that normally from the doctors who'd be using the DSM diagnostic system and be reporting on symptoms and their diagnosis. But over in the family courts, they are so bad. They don't diagnose anything. They don't report the symptoms. It's just really, really bad. So the first step in cleaning it up over here is to document the symptoms with clarity. Now, I don't care if they want to or not. They need to document the symptoms. So if you go to my website, drchildressconsulting.com, I have three sections to that: the attorney resource page, the mental health resource page, and the parenting resource page. You probably want to become familiar with all three of those. But on the mental health section are the diagnostic protocol, the two instruments to document the symptoms: the diagnostic checklist for pathogenic parenting and the parenting practices rating scale. So there's my my website there. That's what it looks like. And if you go to the mental health section there, then you will find that the diagnostic checklist, the parenting practices rating scale, and the parent-child relationship rating scale. That's a little 7-point scale on the child's symptoms. You rate them every day, and you send that in three numbers: affection, cooperation, social involvement. You send that to the therapist. They should be using this. The symptom rating scale from you, the parent-child relationship rating scale, affection, cooperation, they should be using that. That's valuable information. But they don't care. They're just ignorant like a rock. They're awful. However, that's symptom documentation information. Our treatment plan is going to be based on the child's symptoms and what's happening with the child's symptoms. Are they getting better? Are they not getting better? So we're going to need that information from the parent-child relationship rating scale, your ratings on affection, cooperation, and social involvement, three numbers emailed to the therapist, the coordinating family therapist. So you can start doing that anyway right now. You can start sending the therapist your ratings whenever you're with the kid. And if the kid refuses or they don't show up, that's a rating of 1. That's the no. But anything, if they're with you, you can rate them on a 7-point scale. And just send that to them. If they don't use it, so what? I mean, they're awful, but at least you're doing the right thing. Do the right thing, let outcomes take care of themselves. Just document the symptoms, give them the documentation for that with the parent-child relationship, and ask them for their documentation of the child's symptoms using uh, the diagnostic checklist for pathogenic parenting and the parenting practices rating scale. Now, the diagnostic checklist is three diagnostic indicators, real simple, just three of them. The first one is attachment suppression towards a normal range parent. The second is 5 narcissistic traits or phobic fear of the parent displayed by the child. The third one is a persecutory delusion displayed by the child. And then it has 12 associated clinical signs that are often present but not always present. Now, if you look at those three diagnostic indicators, the first one is attachment suppression towards a normal range child. That's to catch the directional change in the child's attachment motivation. The child, that's a normal range parent, but the child's trying to flee from a normal range parent. That's your factitious disorder imposed on another, your factitious attachment pathology. The second one is what I call the fingerprints of psychological control by a parent. So that's your psychological control symptom. Because children don't have narcissistic personality disorders, but I got 5 traits of that's because they're being controlled by a narcissistic parent. They have the attitudes and beliefs of the narcissistic parent and or the phobic anxiety, and it'll meet DSM criteria for specific phobia. Except it's a parent phobia, it's a mother phobia or father phobia. Those don't exist. So that's a false phobia there. But those two first symptoms, though, are supportive symptoms. They're not the diagnostic symptom. The diagnostic symptom is the third one, and it's really only a one symptom diagnosis. Is there a persecutory delusion in the child? Because the only source of that is a shared or induced persecutory delusion. So we want to know, is there a reality base to the child's fear of the parent, or is, that they believe they're being malevolently treated in some way? Is that a reality base to that? In which case it's child abuse by that parent. Or is that a false belief that they're not being malevolently treated in some way? And then it's a fixed and false belief maintained despite contrary evidence. That's a delusional disorder. So it's going one way or the other. It's going to be child abuse one way or the other. And that's what we need. We need that symptom. Is there a persecutory delusion? But when you ask the involved mental health people, they say, I'm not going to tell you. You parents, you say, would you tell me whether there's a persecutory delusion here? And they say, I'm not going to tell you. That's insane for doctors to be saying that. You go into the doctor, you have some sort of medical problem. You say, doctor, do I have cancer? He says, I'm not going to tell you. What? But that's how bad your psychology people are in the family courts. They won't tell you what the symptoms are. Because the moment they do, they have to diagnose the delusional disorder and the child abuse, and they don't want to do that. They're not doing that, and for a variety of reasons, failure, duty to protect. Oh my God, it's so bad over here. But first way out, diagnosis of pattern match, symptoms to diagnostic criteria. So let's get the symptoms. Let's get a rating on the symptoms. Let's document those up so that we can then apply the diagnostic criteria and hold them accountable for applying the diagnostic criteria. So, the diagnostic checklist, it's not complicated. It's just 3 things. It's really, really simple. Is the child rejecting a normal range parent? Okay, that's the critical part. The child's obviously rejecting a parent. The question is whether that's a normal range parent. So what we're going to do is have them document your parenting as being abusive or normal range using the parenting practices rating scale. So that's your second instrument. And then we want to know, is the child very angry or very afraid of the patient? Yes, they are. That's why they're rejecting. So those first 2 symptoms are kind of there. The symptom we want to know is, does the child have a persecutory delusion? Please tell us that. And if you don't know how to tell us that, get us over to somebody who does know how to tell us that. If you're a forensic psychologist and you don't diagnose pathology, then you're pretty irrelevant because that's the diagnosis we need. And so get us to somebody who will give us that diagnosis because this is child abuse. And we need that diagnosis to know whether or not it's child abuse. So, my goodness gracious. And then we have the 12 associated clinical signs. Now, these again are not diagnostic. These are from Dr. Childress. These are just really interesting, but their use of the word forced and exclusion demand, excessive texting, role reversal, and things. And remember, there's research data. Excuse me, there's research data on how often these show up. So like all families, 46 families in the family courts, who had the 3 diagnostic indicators had at least 5 of these. And like 45 of the 46 had 8 or more of these associated clinical signs. So if you have a child rejecting a normal range parent, never happens. That's children don't reject normal parents. And plus you have 5 narcissistic traits displayed by a child, or a phobic mother phobia or father phobia, and you have a persecutory delusion, and you have 7 associated clinical signs. There's only one thing that's going to produce that, which is child psychological abuse by the allied pathological parent. So please, mental health people, tell us whether these symptoms are present or absent. And when you parents go and say, would you please complete these to tell us whether the symptoms are present or absent? They say, no. That's what they say. They say, no, I'm not going to tell you. That is insanely bad professional practice. Okay? So when they do that, just stay calm, document that they've done that, and make sure you get emails back and forth that you've clearly stated, be calm, be everything. Just know you're not talking to them. When they're that bad, they're irrelevant. Okay. When they're that bad, you're going to be writing documenting this up for the malpractice lawsuit, for the children's malpractice lawsuit, for the board complaints, for the follow-up you're going to do. This is called letter to a stranger. So document them up that you've asked them to complete these 2 instruments and that they've refused to complete the 2 instruments. Then we'll move on to the next phase. I'm talking phase 1, document the symptoms. So that's interesting, the associated clinical signs. Now, in addition, we're going to want the targeted parent. Are they a normal range parent? And this is a critical piece of information. And we're going to get this with the parenting practices rating scale. So basically, we're going to decide, document, get some information from the mental health people, all of them, whether they see the targeted parent as an abusive range parent, in which case identify what they're doing, or whether they're a normal range parent. And there's problematic parents on both sides. There's normal range problematic, but it's not severely problematic. Or are they normal and healthy? And we want them to document that with clarity, because we're going to be making decisions about whether this is a true fact or a false, factitious disorder. Is it true or false? And so we need to know whether the child's desire to flee the parent is being caused by the abusive range parenting of that parent. Or if it's not, if that's a normal range parent, in which case it's a factitious attachment pathology. We need that information. So ask them to complete a parenting practices rating scale on your parenting to identify what your parenting is. And they can do it, and we'll talk about that other videos on assessing their parenting. Applied behavioral analysis, and it's relatively easy to do. So those are the 2 instruments that we need from these people. And it's going to give us a differential diagnosis. And here's our diagnosis. Either the targeted parent is abusing the child in some way, causing the child to flee from that parent, causing the child's attachment pathology towards that parent, or the allied parent is psychologically abusing the child by creating a shared persecutory delusion and false factitious attachment pathology in the child for secondary gain of manipulating the court's decisions on child custody. So there's your differential diagnosis. It's going to go one way or the other, either a true pathology or it's a false pathology. One way or the other. So we just need to document which one it is. So we document diagnostic checklist and the parenting practices rating scale. We'll do that. And so that's exactly what we got. For whether or not the targeted parent is abusive, that parenting practices rating scale is going to answer that. And then whether the elided parent is abusive is going to be the diagnostic checklist for pathogenic parenting. You put both of those instruments together, and you will have the diagnosis. So ask all your mental health people to document that for you, please. Because if you're going to come consult with me as Dr. Childress, that's going to be the first thing I'm going to ask. What did the mental health people rate on the diagnostic checklist in parenting? And if they say they haven't rated it, I'm going to say, go back and ask them to rate it because I need that information to consult with you. As your doctor, consulting doctor, I need them to document the symptoms that they see. They're current doctors, insanely bad doctors, to document the symptom. So please, I need that for continuity of care. I need to provide appropriate consultation to you. So it's really important for all parents out there to understand this. The patient should never have to explain the pathology to the doctor. You do. So that just gives you a sense of how bad things are in the family courts when the patients are explaining the pathology to the doctors. That's really bad, but that's the situation. So the first step in remediating your doctors, getting them back on track to being like real professionals, is to get them to document the symptoms so that we can apply our diagnostic criteria and find out what's going on. Is a targeted parent abusive? Is the elided parent abusive? One of them is abusing the child. Now, all the big head honcho forensic psychologists definitely won't want to give you that information because first, they don't know how. The second, though, is they'll diagnose delusion. But the second is if they do, then they admit they haven't been doing that this entire time. They haven't been diagnosing the child abuse or the factitious disorder. And so we're in the middle of a cover-up phase from the big head honcho psychologists are covering up their misdiagnosis. Oh my gosh, it's so bad in the family courts, so bad. First step out, document the child's symptoms. So, and then I'll be consulting with you in various ways over the coming days and things regarding what's happening here. So, yep, that's step one. Document the symptoms. And with that, I'm going to head off to my Sunday here, if Mr. Pippin ever gets off my lap. And we'll talk with you next week about some other aspect of the family court situation. Bye-bye, everybody.